Introduction. Postpartum depression, PPD, and anxiety are significant mental health issues that affect many new mothers worldwide. Despite being common, these conditions are often misunderstood and underdiagnosed. This comprehensive essay aims to provide an in-depth exploration of postpartum depression and anxiety, including their definitions, prevalence, causes, symptoms, impact, and treatment options. Understanding these conditions is crucial for supporting affected individuals and fostering a more informed and compassionate society. Definitions and distinctions. Postpartum depression, PPD. Postpartum depression is a type of major depressive disorder that occurs after childbirth. It can develop any time within the first year postpartum but is most commonly seen within the first 3 months. Unlike the baby blues, which are relatively mild and transient mood swings that affect up to 80% of new mothers, PPD is more severe and persistent, requiring medical attention. Postpartum anxiety. Postpartum anxiety, while less frequently discussed than PPD, is equally important. It includes a range of anxiety disorders that can occur after childbirth, such as generalized anxiety disorder, GAD, panic disorder, obsessive-compulsive disorder, OCD, and post-traumatic stress disorder, PTSD. These conditions can significantly impair a mother's ability to function and care for her baby. Prevalence. Global prevalence. PPD and postpartum anxiety are global issues, affecting women across different cultures, socioeconomic statuses, and geographic locations. Studies indicate that approximately 10 to 15% of new mothers experience PPD, while postpartum anxiety may affect up to 20% of women. These numbers are likely underestimates due to underreporting and misdiagnosis. Variations by region. Prevalence rates can vary significantly by region due to cultural, economic, and healthcare differences. For example, higher rates of PPD have been reported in low and middle-income countries, where access to mental health services is often limited. In contrast, countries with robust healthcare systems may report lower prevalence rates but still face significant challenges in addressing these conditions adequately. Causes and risk factors. Biological factors. 1. Hormonal changes. The dramatic drop in estrogen and progesterone levels after childbirth can contribute to PPD and anxiety. Additionally, thyroid hormone levels may also drop, leading to feelings of fatigue and depression. 2. Genetic predisposition. A family history of depression or anxiety increases the risk of developing PPD or postpartum anxiety. Genetic factors can influence an individual's vulnerability to these conditions. Psychological factors. 1. Personal history. Women with a history of depression, anxiety, or other mental health disorders are at higher risk for PPD and anxiety. 2. Personality traits. Certain personality traits, such as high levels of neuroticism or low self-esteem, can increase susceptibility. Social and environmental factors. 1. Lack of support. Limited social support from family, friends, or the community can exacerbate feelings of isolation and stress. 2. Stressful life events. Events such as financial difficulties, relationship problems, or the loss of a loved one can trigger or worsen symptoms. 3. Childbirth experiences. Traumatic or complicated childbirth can lead to increased risk of PPD and anxiety. This includes preterm birth, delivery complications, or having a baby with health issues. Symptoms. Postpartum depression. 1. Emotional symptoms, persistent sadness, feelings of hopelessness, and frequent crying are common. Mothers may also experience intense guilt, shame, or feelings of worthlessness. 2. Cognitive symptoms, difficulty concentrating, making decisions, and remembering things can be significant issues. 3. Physical symptoms, fatigue, changes in appetite, and sleep disturbances, either insomnia or excessive sleeping, are frequent. Some mothers may experience physical aches and pains without a clear medical cause. 4. Behavioral symptoms, withdrawal from social interactions, loss of interest in activities that were once enjoyable, and neglect of personal care or responsibilities are common. Postpartum anxiety. 1. Emotional symptoms, persistent worry, feelings of dread, and heightened irritability are typical. Mothers may have intrusive thoughts about potential harm coming to their baby or themselves. 2. Physical symptoms. Symptoms can include a racing heart, shortness of breath, sweating, and dizziness. Panic attacks may also occur. 3. Behavioral symptoms. Avoidance of situations that might trigger anxiety, excessive checking on the baby, and an inability to relax are often observed. Impact on mothers. The impact of PPD and anxiety on mothers can be profound. These conditions can impair a mother's ability to bond with her baby, perform daily tasks, and enjoy her life. In severe cases, PPD can lead to suicidal thoughts or behaviors, necessitating urgent medical intervention. On infants. The effects on infants can also be significant. Babies of mothers with untreated PPD or anxiety are at higher risk for developmental delays, behavioral problems, and emotional issues. The mother-infant bond may be disrupted, leading to long-term consequences for the child's emotional and psychological development. On families. The broader family unit is often affected as well. Partners may experience increased stress, feelings of helplessness, and even depression themselves. Sibling relationships and the overall family dynamic can be strained, leading to a less supportive and nurturing environment for all family members. Diagnosis. Screening tools. Healthcare providers use various screening tools to identify PPD and anxiety, such as the Edinburgh Postnatal Depression Scale, EPDS, and the Generalized Anxiety Disorder 7, GAD-7, scale. These tools help in assessing the severity of symptoms and determining the need for further evaluation. Clinical assessment. A comprehensive clinical assessment by a healthcare provider is essential for diagnosing PPD and anxiety. This assessment includes a detailed medical history, evaluation of current symptoms, and consideration of potential risk factors. A physical examination and lab tests may be conducted to rule out other medical conditions that could mimic or exacerbate symptoms. Treatment options. Psychological interventions. 1. Cognitive behavioral therapy, CBT is highly effective for treating both PPD and anxiety. It helps individuals identify and change negative thought patterns and behaviors. 2. Interpersonal therapy, IPT focuses on improving communication skills and building social support networks. It is particularly useful for addressing relationship issues that may contribute to PPD and anxiety. 3. Support groups. Peer support groups provide a safe space for mothers to share their experiences and receive encouragement from others who understand their struggles. Pharmacological interventions. 1. Antidepressants, selective serotonin reuptake inhibitors, SSRIs, are commonly prescribed for PPD. They can help alleviate depressive symptoms and improve overall mood. 2. Anti-anxiety medications, benzodiazepines or other anti-anxiety medications may be used on a short-term basis to manage severe anxiety symptoms. However, these medications are typically used with caution due to potential side effects and dependency issues. Lifestyle and self-care. 1. Physical activity. Regular exercise can help reduce symptoms of depression and anxiety. Activities such as walking, yoga, or swimming can be particularly beneficial. 2. Healthy diet. A balanced diet rich in nutrients can support overall mental health. Omega-3 fatty acids, in particular, have been shown to have mood-stabilizing effects. 3. Sleep hygiene. Establishing a regular sleep routine and creating a restful sleep environment can help improve sleep quality, which is crucial for mental health. Alternative therapies. 1. Mindfulness and meditation. Mindfulness practices can help reduce stress and anxiety by promoting relaxation and present moment awareness. 2. Acupuncture. Some studies suggest that acupuncture may help alleviate symptoms of depression and anxiety, though more research is needed. 3. Herbal supplements. Certain herbal supplements, such as St. John's wort, may have antidepressant properties. However, these should be used with caution and under the guidance of a healthcare provider due to potential interactions with other medications. Prevention and early intervention. Education and awareness. Raising awareness about PPD and anxiety is crucial for prevention. Educating expectant parents, healthcare providers, and the general public about these conditions can help reduce stigma and encourage early intervention. Prenatal screening. Prenatal screening for depression and anxiety can help identify at-risk individuals before childbirth. Early identification allows for timely intervention and support, potentially preventing the development of more severe symptoms postpartum. Support systems. Building strong support systems is essential for new mothers. This includes ensuring access to social support, mental health resources, and community services. Encouraging partners, family members, and friends to provide practical and emotional support can make a significant difference. Conclusion. Postpartum depression and anxiety are serious mental health conditions that require attention, understanding, and effective intervention. By recognizing the symptoms, understanding the risk factors, and promoting supportive environments, we can help alleviate the burden of these conditions for new mothers and their families. Ongoing research, public education, and healthcare improvements are essential for advancing our ability to prevent, diagnose, and treat PPD and anxiety, ultimately fostering healthier families and communities. If you enjoyed this video, don't forget to hit that subscribe button and join the Ni655 family. Give us a thumbs up if you liked the content, and make sure to click the bell icon so you never miss an update. Thanks for watching, and stay tuned for more awesome videos.